This lecture will cover Andrews and Bonta's risk, need, and responsivity model. The risk, need, and responsivity model is probably the most influential theoretical model in juvenile corrections. Andrews and Bonta's risk, need, responsivity model is based on three principles. The first is the risk principle. We should try to match the level of services that we provide to an individual to their level of risk. Individuals have static risk factors and dynamic risk factors. Static risk factors are ones that can't be changed, like an individual's age at their first offense, or things that are difficult to change, like their gender identity. Dynamic risk factors are things that we can help change, right? Such as having a chemical dependency. Maybe the person hangs out with antisocial peers. Andrews and Bonta argue that individuals who are higher risk should receive more intensive interventions. We would be wasting services on someone who is lower risk, and by placing them with higher risk folks, we might be exposing a low risk person to an environment in which they can learn more about negative behaviors. We could also be exposing them to more intensive supervision, being under a microscope, and it's hard for anybody to look good under a microscope. The need principle requires that we develop and assess criminogenic needs and target these needs through treatment. Individuals who are high risk should receive the most intense services, while those who are at low risk should receive little treatment. For example, there is a significant difference between a young person who occasionally smokes marijuana and one who's using heroin on the regular. The kid using heroin will require detox and a serious amount of support during and after their inpatient treatment in order to maintain sobriety. The kid who sometimes lights up is not going to require that same level of services. The responsivity principle requires that we try to determine how the people we are providing services to best learn from interventions. We should try to tailor the interventions to the individual's motivations, abilities, and strengths. Right? We, for example, don't want to give programming in English to somebody whose primary language is Spanish, right? They're not going to get anything out of it. When we're looking at the risk-need-responsivity model, we have some special terminology. Right? We have risk factors. Risk factors are variables that are associated with an increased likelihood of participating in delinquency. These can be related to aspects of an individual's behavior, thoughts, disposition, or life circumstances. Individuals have static risk factors and dynamic risk factors. Static risk factors are historical. Right? We can't really change them. So an individual's history on probation, right? Did they do really well? Did they flop? Right? Does an individual have a history of violence? That's static. We can't go back and change that. Dynamic risk factors are also sometimes called criminogenic need factors. These are risk factors that we can change. Right? Criminogenic need factors are dynamic risk factors that are related to a young person's risk of reoffending. So say, for example, a young person has a chemical dependency, right? That's going to be a criminogenic need factor. Or maybe they're hanging out with peers who are involved in delinquency. So thinking about their peer group as a criminogenic need factor. We also have protective factors. These are factors that help decrease potential harmful effects of risk factors. So maybe the young person has a really good relationship with their parents. Right? Maybe they have an activity that's pro-social that they really love to do. Right? These, if we go back and think about Reckless's containment theory or Hershey's social bond theory, right? These are factors that help increase informal social control. Responsivity factors. These are aspects of a young person or their circumstances that shape their ability to be able to make progress in interventions. Right? So an example of a responsivity factor is parental involvement. Right? An individual's motivation, their ability to be able to process information. Right? That's a really important responsivity factor. When we're looking at programs, this is a representation of general goals for many programs that are involved in working with youth. So the question here is to try to figure out what obstacles an individual will face and what tools they have available to them to help them navigate the obstacles. And part of finding the tools is determining what the young person's strengths are and what are the ways that we can build on those strengths to reach positive outcomes. So for example, when we're looking at somebody who's very impulsive, right, how can we help them to be able to think about consequences and control their emotions? Somebody who has pro-delinquency peers, what are the strategies we can use to help them develop a friendship group that's not involved in delinquency? If somebody has poor use of leisure time, right, they're just hanging out or they're using their leisure time just getting into trouble, right, we want to help them develop satisfying recreational activities that are pro-social, right, because these can help increase that informal social control. So this has just been a brief introduction to the risk, need, and responsivity model.